Good evening. We have another new topic, and this is about providing care for people in their own homes and residence. Okay, we have to define first what is home care. In your own knowledge, what do you mean by home care? Okay, you can define simply this word home care. It's a care provided in the homes of our clients. Okay, or we call this sometimes domiciliary help or home help. So we are the one going to the homes of our clients and we provide the care that they need. Now, according to the research, many elderly prefers to be cared at home rather in the residential facility. So what is really the benefits of home care? Why elderly prefers to be cared at their own homes? First, this continue their routine and retain or establish their independence because at home they can do the simple tasks like grooming, they can comb their hair, they can brush their teeth, and do some simple tasks together with a caregiver or the nurse. So it develops their task independently and it continues their routine and retain their independence. Another benefit of home care is the control of cost. So which is more costly, home care or the residential facility? Now, in our homes or in the home of our patient, we only were paid because we are serving or giving our service to the patient, and they are only paying us of our services. Now, in the residential facility, they have to pay the facility for their room, food, and the services of the nurses or caregivers. So, which is more costly, home care or the residential facility? It's the residential facility. So, home care works in a cheaper rates compared with the residential facilities. So that is the second benefit of providing care at home. Next is no stress in moving or transferring in a new environment. Moving out in your comfort zone is very traumatic, especially for patients who are having dementia. They have to adjust in the new environment and adjust with different healthcare providers. But at home, they have their own nurse or caregiver and no need to transfer or adjust because the home is their comfort zone. Regular physical contact with the caregivers. At home, your caregiver or the nurse is 24/7 at your bedside. But in the residential facility, once you need a nurse or a caregiver, that's the only time they will come to your room and ask you about your needs. Clients of caregivers in their home is likely to experience high levels of hormones responsible for lowering stress, blood pressures, and it increases mood. Okay, who are the parts of the team? When you are working the home care, you are not only working alone, but you are working as a team. So who are those team members who works with you? We have physician. Physician is a medical practitioner, the one who examines physically the needs of your patient, not only physically, but also emotionally, mentally, and socially. And he regularly visits the patient to make sure that their health conditions are maintained in normal parameters. Next is the case manager. So who is the case manager? The case manager is a nurse who evaluates the needs of the clients. He must make sure, or he provides report to the physician pertaining to the health condition of the client. And we have the supervisor, okay? The supervisor also is a nurse who is in between the care of, in between the client and the caregiver. The supervisor is the one reporting to the case manager. And supervisor will make sure that the needs of the clients are being provided. And we have the caregiver. Okay, the caregiver is the direct person who provides care to the client. And she is the direct person to the family. And the caregiver is giving the primary needs of the client. And we have one entity, which is the physiotherapist. The physiotherapist works with individual, client, and family who needs physical rehabilitation. So she is visiting the clients twice or thrice in a week. That depends upon the rehabilitative treatment. Now, why is it important to work with others in a team? Okay, first is it creates complementary strength than working alone. It strengthens the organization. So you must complement. You will complement with your expertise. You contribute with your expertise in a group. Like, for example, there are 5 health professionals working with that patient. We have the physician, we have the nurses, we have the nutritionist, we have the speech therapist and physiotherapist. So they have to complement their strength because they share their expertise. Next, it builds trust in each other and it fosters creativity. That learning strives when people work together. And it teaches also resolution skills. So it means when there are challenges in the workplace, so all of those members of the team can contribute how to solve that problem. Now we're going to your daily activity of care. And this is done step by step. Now, before you accept a patient on your care, the outgoing nurse or caregiver must endorse to you. And we call this endorsement. Endorsement is the process of collaboration and summarizing all the interventions that was done within a given period of time. So what is this given period of time? When your duty time is 6 o'clock in the morning until 6 o'clock in the afternoon, so that is the given period of time. You are given 12 hours to provide care to your client. And all the interventions that was done or care actions that was provided to the patient should be endorsed to the incoming nurse or caregiver. What are the things to endorse? Client's details. Now, if you are taking care of 2 and more clients, the maximum, is 5 clients. Okay, that is primary care. And if you are working in the hospital or working in the residential facility, you will be given 1 or more patients. And during endorsement, you have to endorse the client's details. So how? Example, I'm endorsing 5 patients. In room 101, patient Muhammad Ali, 54 years old, male under Dr. Ahmad with the chief complaints of chest pain. Okay, so that is how you endorse. Then go again to the next patient, until you finish the last patient. So you must first give the patient's details. Next is the vital signs. Okay, endorse patient one at a time. Okay, don't endorse the 5 patients just mentioning their personal details or the client's details. No, you have to finish first one patient, then go to the next patient. Okay, now next is vital signs. Okay, so mention at 8 o'clock, the patient's body temperature is 37.6 degrees Celsius, blood pressure of 120 over 80, the mm per mercury, their pulse rate is 68 beats per minute, and the respiration is 15 breaths per minute. We also check the oxygen saturation, and it's 98%, and the blood sugar before meals is 120 mg per diem. So that is your vital signs. The latest vital signs is the one you have to endorse to your patient. Don't endorse your baseline vital signs. When you endorse the patient at 6, so your latest vital signs will be 5 o'clock. Before you leave your patient, make sure you have taken the patient's vital signs. That is very important because vital signs can determine the health status of your patient. Now, next is assessment and complaints. So what are the complaints of your patient? It can be difficult breathing, chest pain, abdominal pain, anorexia, insomnia. Okay, so those are complaints. And assessment, you have to assess the physical appearance of the patient. Receive patient awake together with the mother on bed, with IVF patent on left arm and IV fluid draining well, 225 drops per minute. So it is more detailed. Now, what else? Not only physical appearance, but also emotions. Like, for example, the patient is upset when I receive the patient, or the patient is crying because of, she verbalizes that she's feeling sad of the loss of her pet. So those are emotions. And also you have to assess the patient's attitude. Assessment happens, you remember that? Together with vital signs, your physical assessment from head to toe. And next is regular treatment. If your patient has regular treatment like wound care, your patient is having exercises and a doctor's visit, nebulization or stimulation. So that is a regular treatment. And medications. Medications, we have new medications, we have discontinued medications, we have completed medications. So when medications is only until 7 days or 5 days, especially when your patient is receiving antibiotics, then after 5 days or 7 days, you have to take note that the cephalexin 500 milligrams tablet is already completed. Okay, so you must endorse in details the medication. If patient refuse medication, you as well should endorse to your incoming nurse. Next is feeding. Okay, take note the amount of food consumed. It can be through percentage, like 50% of the food was consumed by patient, or 70% of the food served was consumed by patient. But if you want to write it in details, I mean the quantity of the food, it's much better. Okay, like for example, patient ate one piece of banana, two slices of mango, one slice of bread, or one match box of meat, or a patient took 1 cup of tea, 1 glass of water. So it is in quantity, and that is very important. Next is sleep and rest. And take note also, if your patient again refused to eat, then what are the things that you do when she refuses to eat? Did you ask your patient why she don't want to eat? Or did you give options to your patient? Or ask the patient what time we're going to serve again the food? And you have to take note of anorexia. Maybe patient has having nausea and vomiting, or patient is in tube feeding, or patient is having NPO orders from doctors. Okay, so this is very important to endorse to your incoming nurse. Next is sleep and rest. So you have to take note the number of hours, duration, nap hours, and insomnia. Now, for nap hours, don't let your patient sleep long hours during daytime, because during evening, your patient will stay awake, okay? And it will be a deadly hell, because you cannot also sleep or you cannot rest if your patient is awake the whole night. So basically, we give only 1 hour sleep during daytime, and afternoon as well, 1 hour nap time. Okay, like for example, you give the patient 1 hour sleep from 10, okay, until 11, and afternoon from 3 until 4. Okay, so that is only nap time. Okay, you have to tell and instruct your patient, I'm going to give you 1 hour nap time. Because if you let your patient sleep long time, then during the evening, the patient cannot sleep. Now, family concerns regarding treatment, medical procedures, and financial matters. And step 2, then this is the time you have to do your own assessment, and you have to take your baseline vital signs. Okay, your vital signs as a baseline. You must know the normal values, and you must record and document your vital signs with time, with date and time. Okay, observe any abnormalities and alteration from the normal values during and after the procedure. And when there are abnormalities or alteration in the vital signs, please report immediately to your supervisor. In step 3, after vital signs, let's say the blood pressure is 120/80, the temperature is 36.8. So you can proceed to your morning care. And morning care is usually done before the patient will go to her activities or tasks. Now, we have 2 types of bathing. We have the complete bath and the sponge bath. For a complete bath, you are doing the shampooing. For sponge bath, this is only a partial bath using a piece of towel or cloth. Now, your morning care includes also grooming, like combing the hair, trimming of fingers or toenails, changing of clothes and diapers, brushing of teeth, trimming of their fingernails and toenails, and also perennial care and shaving the facial hair for male patients. Step 4 is feeding. You have to take note if your patient can eat alone on the bed or on the table, if your patient will eat with your assistance, or if your patient is eating through the tube. We have two types, gastrostomy, or we call that PEG, and the NGT, nasogastric tubing. Next is elimination. Okay, you have to endorse if your patient is on diaper, if your patient can walk from bed to the toilet, or if your patient is having urinary catheter and also stool care. Now, step 6, this is about exercises. If your patient is receiving physiotherapy, if your patient is receiving physiotherapy, where? Is it at home or in the hospital or in the facility? Okay, rehabilitation facility. Now, for exercise, you have to take note there are two types of exercise. We have the passive exercise, which the patient cannot perform by themselves. They cannot move their extremities. So nurses or caregivers are the one helping the patient move their extremities. So remember our range of motion. We can do extension, flexion, and rotation. So we have to perform that daily to our patient in order to prevent from bed sores, from any contractures, from shortening of our muscles. That is very important. So for passive exercise, patient cannot do by themselves because of some disorders. Like for example, they have body weakness because of stroke, they are paralyzed, they are unconscious, or they are just having post-surgical, that they have to stay on bed and they cannot move by themselves because of body weakness. So we have to help our patient do the passive exercise. And one type is active exercise. Active exercises the patient can do alone. Okay, they can do alone without the help of a nurse or a caregiver. So this is exercises. Simply walking is an active exercise, jogging, cycling, swimming. But again, for elderly patients, because they cannot tolerate the activity, the heart cannot tolerate the activity because they are already old. Don't let them jog. Don't let them run. Don't let them swim. Simply walking is good for the elderly. Next is treatment. This is step 7, body massage. Body massage, we give that, or back care, we give that during evening care. Okay, and evening care, you have to provide back rub before your client will go to bed. Stimulation, it depends upon the doctor's order. It can be before bed or they can do it twice a day or BID. It helps loosen mucous secretions. Wound care, it facilitates healing and prevents further infection. And we have suctioning, removing the tenacious secretion on the airway. Step 6, we have leisure activities. So this is reading a book or a newspaper, playing cards, playing musical instrument, and strolling with our favorite pet. And the last is rest and sleep. So we must provide conducive environment to rest and sleep. Okay, eliminate noise and keep room temperature at 24 and 25 degrees. But again, you have to ask the patient's need. Some patients, they prefer cold room. Okay, some patient, they prefer warm room. So always ask the patient their needs and allow rest periods between activities and encourage just the time for rest. Now, this afternoon, we are going to have our class activity, and that is your daily care notes. But this daily care notes is different from the one you did during your caregiving. Now, I'm going to explain how you will do this daily care notes. Now, your patient will be, again, Mr. George, and the admin will be giving you the form where you have to write your daily care notes. Now, first, see, there will be 3 columns. Okay, okay, here, I don't know if you can really understand because it is quite blurred. But anyhow, okay, this column should be divided into 2. Okay, here is the date and time. And this is the activity of your patient. Okay, but remember again that each home care or facility has their own form. Okay, not all the healthcare facility has the same form. Okay, but the principle or the concept is the same. There should be the date and time of entry and the activity. Okay, now for the healthcare facility or sector, we are using military time. So what is military time? In the morning, it's 6 o'clock, 7, 8, 9, 10, 11, 12. But when it's already 1 o'clock, we have to start from 13, 14, 15, 16, 17, until 2400 hours. So 2400 hours is already midnight. Okay, so we are using the military time. Okay, now see if your duty started at 6 o'clock in the morning, so you have to write 600 hours. Okay, the H is hours until 630 hours. So let's say this is your endorsement time. But don't write the endorsement time. You have to direct document your assessment. Okay, so here, received patient, and make sure that it should be in past tense. Okay, received patient, awake. Okay, together with daughter. Okay, on the wheelchair. So this is describing the physical appearance of your patient, how you receive your patient. Okay, to on the wheelchair. So you can again add regarding the patient's emotions and the patient's attitude. If the patient is having PEG, if the patient is having NGT, if the patient is having IV tubing or drip, if the patient is having urinary catheter or on diaper, you have to write it in this assessment. Okay, this is how you receive your patient. Now, next step is vital signs. Okay, you have to follow the steps mentioned in your daily activity of care. So you have the steps which we have already discussed, your daily activity of care, and you have to follow it. Okay? The next step is vital signs. So you started, see, 630 hours. Let's say your vital signs lasted 15 minutes. because you have only one patient. Okay. Oh, 45. 645. 100 hours. So vital signs. Okay. Taken and recorded or documented. So you have recorded. So go by one. Temperature, what else? Your blood pressure, your pulse rate, your respiration. Okay, if you took the blood sugar level and your oxygen saturation, you can also write here under vital signs. The next is morning care. Okay, then I see you started morning care at 6:45, 100 hours until let's say 730 hours. Okay, so more than 1 hour. Okay, so you have to write a morning care done. Okay, so what did you offer or provided to your patient? Bed bath, or you let the patient do the shower in the bathroom, or you do grooming, and what are those? Combing of hair, trimming of fingernails. Okay, you have to write it here. Okay, and the next is after each task, you have to gather feedback from your patient. Okay, so how the patient feel after taking a bath? You can ask the patient because from there you are gathering feedbacks from patient. Okay, so then after you have gathered feedback, then you have also to write it here, under morning care. What have the patient verbalized regarding the bed bath? Okay? And the next step again, until you finish, rest and sleep. So that is how you do your daily care notes. Okay, so they will be giving you the form, and you can start now your daily care notes. After you've done with activity this afternoon, just keep your daily care notes and submit to me by next week. Thank you very much, and I hope that all of you can complete today your daily care notes, and I have to gather your activities next 2 week, and I have also to sign your daily care notes by next week. Thank you very much, and God bless.